Hey everyone, it's Dr. Matt with the Ethos Athletes Podcast, and we're continuing our nutrition series today. And today we're going to segue into talking a little bit more about hormones, because part of performance and part of feeling great also has to do with hormone optimization as much as it has to do with what your diet and exercise looks like. And so for today's episode, I have Dr. Alexandra Mayer, who's the co-owner of Ethos Integrative Medicine, where she specializes in women's health and medical aesthetics. Dr. Alex received her doctorate from the Southwest College of Naturopathic Medicine here in Tempe. And the other guest that we have today is our continuing guest from the nutrition series, Kelli Michelle from Keep Moving Forward. Kelli holds a master's in nutrition science, and she works with a number of athletes and the general population on how to fix their diet using macro tracking. So welcome to the show.
Hi. Thank you.
So today, this particular episode, we're going to talk about nutrition and hormone therapy or hormone optimization, I should say, for women. And so to start that out, I'm actually going to have Dr. Alex explain to us some of the basics of women's hormones. So Dr. Alex, what hormones are important in women's health? Which ones are responsible for energy, weight, etc.? I'm sure there's a combination of everything. Can you just kind of delve into that a little bit for us?
Yeah, so there's a couple different things to think of when you're thinking of women's hormones and weight. A lot of people, when they think of women's hormones, only think about estrogen and progesterone and add a thyroid in there. And if that's all you're looking at, you are definitely not going deep enough. So when it comes to hormones, obviously if you're thinking of weight, low energy, thyroid is something that definitely needs to be checked, and it needs to be checked properly. Doing just a TSH is not going to be enough. You need the free T4 and free T3. You need the actual hormones to look at and see where they are. On top of that, you should be running, if you're having thyroid problems, an antibody, a TPO antibody, to make sure that's not autoimmune thyroid, because autoimmune is treated very differently than regular thyroid, or at least it should be. And then when it comes to estrogen, progesterone, and testosterone in women, all of those things are super important to run as well, but you also need to be running a cortisol. So a lot of people don't realize that when it comes to hormones, if you're looking especially in like the perimenopause and menopausal phase, as your ovaries shut down, your adrenal glands are actually what's picking up your hormone production. And so if you go through life and you're stressing out your cortisol and you're stressing out your adrenal glands, and now you don't have enough cortisol, your adrenal glands aren't going to produce hormones the way that they should be producing them in perimenopause and menopause. So looking at that kind of thing is also really, really important. And then I would also add in a DHEA, particularly a DHEAS, which is going to be a precursor hormone to some of your other hormones. And so basically the way I explain to my patients is, if you don't have the building blocks, you're not making the rest of it. That's just life. That's how it works. Okay.
Now, can you talk about if someone is having low energy, their thyroid can obviously be affected, their cortisol can also be affected. What about weight gain? What hormones are we worried about with that? And how about libido as well?
So with weight gain, if you're looking at just weight gain, definitely you want to be looking at a thyroid and a cortisol. Cortisol will definitely impact particularly that abdominal weight gain in women, where they just can't seem to get rid of that. But testosterone is also super important for that. And with that, you're going to be noticing changes in energy, changes in weight, but also changes in muscle mass. So it looks really different when you're looking at it. Like thyroid's going to be an overall increase in weight, whereas testosterone, you're going to be noticing that you're not quite as strong, and that you're struggling a little bit more in the muscle mass department, along with libido and energy. So it kind of just shows up a little bit differently too.
And what are you typically seeing in your practice? Is it women coming to you for low libido? Is it weight? Is it energy? What's typically...
Number one thing I see in my practice is low energy. And if you think about it, that will affect everything, because your decisions on what you put in your mouth in terms of your nutrition, whether or not you're able to go out and actually exercise, all of that is dependent on how you feel. And I see a lot of women that know they're not making the best decisions, and that's because they just don't have the energy to go out and do it. So that's the number one thing that I see. Almost always with low energy, they're coming in and they are experiencing changes in their weight, which is kind of like their secondary symptom, and then changes in their libido as well.
Okay, and is this typically older women, or are younger women affected by these hormone imbalances as well? What have you typically seen, and how common is it in the age groups?
So I would say in older women, I definitely see it in older women, but I see it a lot in like that perimenopause and menopausal phase where the testosterone and estrogen and progesterone are all starting to shift. And particularly you need to start looking at that cortisol. Now that said, I treat a lot of younger women in my practice as well. And with them, I see a lot of thyroid disorders where their thyroid's just not quite functioning very well, not necessarily out of the reference range, but where it's definitely sluggish. And in that, almost always you'll see a change in cortisol, and you kind of have to back up and treat the adrenal glands, because if you just treat the thyroid, you are not going to feel better.
Okay, and is that commonly done in medicine, where just the thyroid is addressed?
No. I think a lot of the time, I have a lot of patients who come in with labs that honestly I look at it and they get told that their labs are completely normal, and they're not. Like their labs are not optimal, and just because it's in the reference range does not mean that your thyroid is functioning. And then on top of that, once you have that conversation, most of the time cortisol and DHEA haven't even been run, and so you have to go and back up. And then I also talked about doing antibodies. You know, I can't tell you how many times I have patients who have been on thyroid medication for years and they've never had an antibody run. And if you have high antibodies, your antibodies should be treated. It's not something that's like, oh, whatever, your antibodies are high and we leave it. Like, you shouldn't leave it. They need to be treated. And there's ways to do that, and I think that's missed a lot.
Okay. So your thyroid can be off, your testosterone can be off, your estrogen can be off, your cortisol can be off, right?
Yeah.
Okay. So what causes all this?
So what causes it? That's a loaded question.
That's a loaded question.
All right, thank you. So honestly, I think a lot of it has to do with lifestyle, like lifestyle imbalances. So things like food sensitivities and what we're putting in our food, like how our foods have changed in terms of what you're actually putting in your body. But on top of that, the amount of stress that we're under. If you think about like men and women with testosterone, we're taking in things like plastics and stuff like that. We're drinking water out of plastic water bottles, and all of that affects your hormones. Women, they say that they put 30 products on their face and on their body from the time they wake up in the morning to the time they leave their house. That's 30 products that are all probably going to have endocrine disrupting compounds in them, which are going to change your hormones. And so even things like that, like, you should be looking at all of that with your patients as well. And then with the chronic stress that we're under, like I said, your adrenal glands take over a lot of your hormone production at some point in your life. And so if you stress those out, they're not going to do that. And then even when you think of thyroid, like for example, T3, which is the most active thyroid hormone that you have in the body, T3 requires cortisol at a cellular level to be used properly. So if your cortisol's in the tanks and your thyroid's functioning properly, it's not really going to function properly, even though your labs say it's going to function properly.
Okay. So can you recap, if you have someone, or you have a woman who's having these symptoms, can you give me a list again of the different labs that you're going to be looking for, or what's if someone's going to the doctor, what list of things should they bring up to their doctor?
For sure. So let's say somebody's coming into my office for, we'll say low energy, a little bit of weight gain, and particularly like trouble losing weight. And we'll say that they do have change, like they are experiencing some changes in their cycle of some sort. So with that person, I'm going to run a DHEA and a cortisol. And that's particularly to check adrenal gland function, but also DHEA is important for the conversion to testosterone. It's important for a couple things, but particularly to check adrenal gland function. I'm going to run a TSH, free T3, free T4. And then at that point, if that came back really abnormal, I would decide to do potentially a TPO antibody in the future, but I probably wouldn't run it right at that point. And then I would run testosterone, estrogen, and progesterone. And if they're having particularly that abdominal weight gain, I would also run a fasting insulin, which I think is really, really important. Fasting insulin is one of the things I see be off a lot in patients. And the way I look at it is your diet needs to be tailored to you. Oh, yeah. And so if you're not getting labs run that help you tailor the diet, what's the point? So I would run that as well.
Absolutely. That makes complete sense. Now, speaking of diet, a lot of women, when they're feeling these symptoms of low energy, weight gain, etc., the first way to go about treating it is through diet and exercise typically. So Kelli, can you tell me a little bit about what you see with individuals who choose to address this with just diet and exercise?
Sure. There's a couple things that Alex did an awesome job of explaining the hormone function. For me in particular, correlatively, I see the biggest issues with people who are carb restrictors and don't get enough sleep, and they go hand in hand. Typically, women that do not sleep a whole lot restrict carbs because they think it's the only way that they can lose weight. And basically what they're doing is just kind of mixing up a cocktail for disaster. Because again, when you do not sleep, your hormones don't reproduce at night well, and the dry erase board is cluttered with lots of words from yesterday and the day before, right? So it never has a chance to be wiped clean. Tabula rasa, that's nerdy Latin for blank slate. But nonetheless, basically, yeah, I know, super nerdy. But nonetheless, what I see correlatively between the female athletes and non-athletes is that, and again, I like how Alex addressed the older population and perimenopausal and menopausal women. I have them as a subcategory with my data sheets, and I try to keep them in kind of a category of their own because a lot of them do trend very similarly. They do trend more slowly when it comes to weight loss, just because, again, some of them are not being treated for hormone therapy, and the ones that are early in the phases, and it takes a little time to get those hormones nailed. So correlatively, with testosterone and thyroid in females, I usually will see the lower thyroid function in women who have been either overtrainers, particularly when it comes to endurance athletes and people who do a lot of cardio-based exercise, not weight training specifically. I do also see low T3, T4, TSH in women who have been bodybuilders, former yo-yo dieters, and competitors because of the restriction to carbs and fat. So the primary body's energy sources from fat and carbohydrates. So a lot of these women have been living off of protein for fuel for many, many years. And obviously, Dr. Alex spoke about like sarcopenia and muscle loss. That's one of the things that you can kind of see in their body mass index too, is if they're getting body mass index done and they're trying to lose body fat and they just keep losing muscle, and you have their macros or their calorie structure set up for muscle gaining, and they just keep losing, you may correlatively have a reason to ask them to go and have their hormones tested. I actually see it in their data trending. So if I give a client about 60 days and I slowly move them to a fat burning set of numbers with their calorie structure through macronutrients, and I don't see them trending the right direction, which means that their body fat loss would be about a half a pound to a pound every week or week and a half. After about 60 to 90 days, I will have them go get their panel run, and about 1 out of every 5 does have issues because of their prior dieting history in particular, I would say, and again, lack of sleep. So correlatively, most of these women are sleeping under 7 hours a night.
Okay.
Correlatively, about a third of them have 1 or more children as well, and correlatively, about half of them, half of that 1/3 would be more than 2 children.
Okay.
So, and claimed to never have bounced back after the second child. And it's different for everyone. Because again, it's a hormone shift and then it's a recovery, which I think a lot of women don't actually do. They just diet right away. They just start dieting right after breastfeeding, or they just start dieting right after they give childbirth. And they're now in a huge calorie deficit.
Okay.
Because again, when you're breastfeeding, you need to be eating a lot more food, not less, a lot more.
Right.
In some cases, I will have women at 1,000 calories over their maintenance, and they're maintaining weight.
Okay.
Or losing every week.
Okay.
Yeah, it's mind-boggling. So if you think about the trauma of having a child, they never fully recovered from that. Mm-hmm. In fact, they went right back to the gym. And so where it might have worked for somebody who was hormonally optimal for the first child, maybe it doesn't work the second or third time. And that's probably something that you can talk about a little bit, Alex. But with food, when I get somebody that is like that, that has T3, T4, or T3, T4, TSH, and testosterone issues, because I do see that a lot, the best way for me to feed them is to keep doing what I'm doing. And obviously, most of these women that have come to me and I recognize that they've got these issues and they go get the testing done are eating so little food when I get them that I've already done the best that I can do to get more calories into their body. And they're not gaining, they're just not losing.
Right.
They're just not losing. Typically, when you have somebody who's in a 500 to 800 calorie deficit and you give them more food, their body loves it and starts letting go of body fat. The reverse diet.
Okay.
So, we've talked about the reverse diet. So
right.
adding more calories and losing body fat, or actually getting to a place where you can start adding muscle mass. So again, correlatively, if these women have issues with sarcopenia, there's also probably, some margin for error with their under-eating protein consumption in the past and carbohydrates, and together those are anabolic. As you know, you can't really build muscle without those.
Right.
You can't build muscle on a high-fat, no protein, and no carbohydrate diet. It's just, you're not going to be able to do that.
Right.
So, again, we have some gaps to fill there, but I would say this, most commonly, it's just yo-yo dieting.
Okay.
Low carbs, too much cardio, not enough strength training. I'm glad she mentioned A1C, because I do have all my clients get fasted glucose done, and I'm astonished how high or low it can be. And again, there can be correlation with cortisol as far as, the insulin levels and their cortisol levels. So I'm glad that she pulls that, because there are a lot of doctors that don't pull any of it. So
for sure. So under eating, carb restriction, no
Yes.
sleep, overtraining. Dr. Alex, is that all stuff? Are those trends that you see with your patients as well?
Yes, absolutely. I see all of those trends with my patients. I will tell you that a good majority of my patients that come in that are having trouble losing weight and are low energy, their cortisol ends up being super low, and a lot of that has to do with the fact that they are overtraining and undereating, and so they're giving their body stress and caffeine.
It's
that's a good point.
Unbelievable, the amount of caffeine, and I'm like, oh, can you cut that back by a quarter? And what's interesting when you start adding the food too, what their feedback is, even without the HRT, because again, sometimes it'll take a month and a half to get them in, to figure out whether or not they want to do a compound, or if they want to go the natural route for a while and see if that works. And I will say this, 50% of the time, or just about half of the time, the natural route does work for these people. So adding the DHEA, adding the omega-3 fats, because again, like most of the Americans do not consume a diet high in omega-3s. It's 6s and 9s. Yeah. And they don't realize a lot of this is just low dietary fat too. So you see these women come in, they're not even eating any fat.
Yeah. Well, and I see that a lot in my patients where the natural, I would say probably about 50% of the time I would agree with you. But the caveat to that is that I always add herbs to that. So herbs for hormonal stuff are
huge,
phenomenal and amazing. And like my younger patients that are having abnormal cycles, herbal medicine will get it right on track. I absolutely love it. And even in menopausal women, it works awesome.
It works
so as
great.
long as you do building blocks, some herbs to get it there, absolutely. There are things to do.
Yeah, I agree with that 100%. And if they're not so depleted, like I see very low end. So like I'm going to be honest, I don't normally see people who are like mid-range. I see very low end. So they're like, and most of these people end up with me because they're at their wit's end. They've tried every diet, they've done every yo-yo diet, they've done every cleanse, every detox, every wrap, every this, every that, and they feel like garbage. But that stuff doesn't really start to come out until I start educating them. And then you get the emails that are like, you know what, I'm really glad that you talked about this subject on the Monday Night Live, because I do have no libido. I don't have any desire to want to go and do the things that I used to love to do. And I'm like, that's a problem.
Absolutely.
That's a problem. The other thing is, and you know this, Dr. Alex, that the brain does not work properly if your T3, T4, and testosterone are not functioning. If they're insufficient, the brain can start working differently. You don't have that optimism anymore because
motivation and
you look at the female cycle and week 3 and 4 are just like that anyway. You might as well jump off a cliff. You know, week 1 and 2 are awesome, and you feel strong, and you've got that surge of testosterone, and everything feels great. And then if somebody's already low, they feel that way all the time, right? So,
and I think that that's actually like a really good point to make. Is in women, hormones are complicated. They're super complicated. They change throughout the cycle. In menopausal women, it's a lot easier. The definition of menopause is that things are low. But in younger women, I mean, you're supposed to cycle your hormones. So
yes.
Estrogen's supposed to be high, and then progesterone's supposed to be high, and everything changes throughout the month. And so it's different in women than it is in men. And so I think that's important to think about, because a lot of people just think, I just need my hormones to be high. That's not how this works in younger women.
And with my clients, I take it a little bit of a step further. I ask them to tap the brakes week number 3 before their cycle. I ask them to have more grace with themselves. I ask them to back off on the training and cardio especially. I ask them to do more strength training at a higher rep range, lower volume, you know, not heavy, and just tap the brakes and be okay with 3 or 4 workouts. Do all of them listen? No. Do most of them listen? Yes. I would say 3/4 of them tap the brakes. I get an email saying, this was my cycle week. I decided that I would take 4 rest days instead of 2. And I feel really good. And what you'll see with that, too, is at the end of the week, they're not up in weight. They're actually at the same weight that they were going into cycle week, where before it was 2 or 3 pounds heavier, and they would just hang themselves because they jumped on the scale. Now they don't even get on the scale. You know, they just save themselves a treacher of doing that, you know. So you're right, the hormone fluctuations for women, it's every week, you know. And if you explain to them what's going on and what they should be doing, usually they're very receptive to making those modifications for that 7 to 10 day period. And then I tell them, come out with a vengeance after your cycle. Get in the gym and hit it, you know. And hit it hard the next week, because you've got a good 7 to 10 days of just absolute monster training. But, you know, have some grace with yourself, because, again, if you're a crazy person and you're treating your family, you know, like a crazy person, you need to get your hormones tested.
Absolutely.
That's not normal to have PMS for 10 days.
No, it's not normal. And that's what I tell my patients. And you'd be shocked how many people come in and think, this is just life. Everybody has this.
I feel bad for men.
That's not a thing.
I'm like, these poor husbands, you know. But then I also feel the same way, you know, going the opposite direction when a male has low test, because I've had males just burst into tears in my office, and I'm like, wow, this isn't a nutrition issue. I would be willing to say this is probably a hormone issue, you know. So
absolutely.
It goes both ways, right?
So we talked about some of the basics of hormones, symptoms that people can experience, and then why, you know, why stuff doesn't seem to work and why it's not easy to fix. So let's start off, and we've already gone into some of it with cycling, rest, exercise, and modifying, but let's talk about nutrition first. On what are some things that women can do on their own to start feeling better, and you know, kind of the first line of getting better and getting rid of these symptoms. So
we talked about this with Gen Pop, and when we did the Gen Population fat loss episode, and step number 1 would be track what you're eating. Use a nutrition tracking device to start tracking what you're eating. That way you can look at your calorie consumption, and you can see with the macros, fats, carbs, and protein, if you're getting enough protein and fat to actually start working on building a baseline so that you can have enough carbs for your activity level. A lot of these women are very active, and I mean overactive, because they're so scared about that weight gain, or they've been so scale conscientious that they've been overtrainers or over cardioers or just regular gym goers for a very long period of time. But your body adapts, and obviously the metabolism will downshift when you start eating less food to accommodate for things that would now take less calories to do, like walking, digestion, etc. So just getting a starting point and seeing, oh my gosh, I'm eating 1,200 calories, but my maintenance is 2,200. I have 1,000 calorie difference there. Maybe that could possibly be one of the reasons that my hormones are not sufficient anymore. And then being able to slowly reverse diet, adding, you know, if their dietary fat's really low, adding more good omega-3 fats. And so I have to give people specific instruction on that. Because me just saying, hey, can you try to eat more omega-3s is not enough, because they don't know what those are.
Right. Absolutely.
They do not know what they are. They don't know that there are high-quality supplements versus low-quality supplements.
Absolutely.
So getting a very good high-quality omega-3 krill or fish oil or cod liver oil, MCT, those sort of oils that they can supplement with as they're kind of building their fat calories up a little bit higher. I usually will work on fats first, because I typically see that the women who have issues with thyroid or TSH, T3, T4, are usually very low in fat. They've been dieting off of a low-fat diet, and a lot of times I would say 50 to 75% of those are also on a low-carb diet as well, and they're eating under 1,200 calories, right? Because again, all of the magazines used to say eat less, do more, and that's really a cocktail for people, for a disaster for people in their 20s and 30s. We're starting to see low hormone optimization in like really, really young women now too, and I would say that birth control is probably one of the major reasons for that as well.
For sure.
So.
Absolutely. And I mean, with birth control, one of the things to think about is that birth control will change your cortisol, but it can also change things like reverse T3. So birth control, you tend to convert some of your T3 into something called reverse T3, which is inactive and binds up where T3 is supposed to activate. And so it basically is like driving around a parking lot. There's no spots for your T3 to go in, and all of it's reverse T3, and that's going to do nothing. And birth control does have a tendency to do that, along with changing a lot of other hormones, but that's one of the things that it does.
A lot of my clients do also come off of their birth control, and I don't say anything to them about that, because I'm very careful to let the experts, Dr. Alex and the endocrinologists and the hormone replacement doctors that they're seeing, do their job, but they come off of it willingly by themselves. And I actually had one that I'm going to speak with this week. I said, do you have like 5 minutes you can call me? I just want to tell you what to expect when you're doing that. So that you don't, I don't lose you as a client for nutrition, because you're going to change your hormone profile, and it's going to take a few months for you to correct. And she might be listening, because I've got you guys on the live right now.
Oh, awesome.
They love the live. So if you guys can hear us, give us a thumbs up. But nonetheless, it's a beautiful place when these people are actually not just looking at their nutrition profile and now hormones, but also like the lifespan of their quality of life, from that point forward. So I get 50, 40, and 50-year-olds that are like, man, I wish I would have known that I was depleted 10 years ago, because I could have had that quality of life back. And I'm like, it's kind of like somebody that realizes that they have stage 1 cancer, and they change everything about their lifestyle. And I just spoke with another gal today who is 1 year in not remission, but found out she had breast cancer a year ago and changed everything. And she goes, oh my gosh, I've still got the cancer, but I feel so good because I'm doing all of these things. I'm sleeping 9 hours a night. I was sleeping 6 or 7 hours a night before. She goes, and so, my quality of life is so much better, Kelli. If I go, I'm okay with that. And I was like, ah. And of course, it sent an emotion, but it's like, when you really start looking at things like hormones, chronic disease, I wish people would look at it before they have an issue. I wish I would have looked at it before I had an issue,
For sure.
So that's why I love the education side of things, that, Dr. Alex can bring that perspective. What do you look for? What are the major long-term ramifications of staying in that place?
Yeah.
Nutrition, unfortunately, can only do so much, but I have seen miraculous things with lab work. Just miraculous. Even in 90 days, 120 days, I have a client, Sandy Holzer. She won't mind me using her name at all. We've talked with her live on my feed. She came to me and she was literally pretty much type 2 diabetic. They told her she was pre-diabetic. On some scales, she would have been a pre-diabetic. On my scale, she was a diabetic. Type 2, non-insulin, obviously. They wanted to put her on, some drugs to bring her blood pressure down, and she was having issues with cholesterol as well. We did 90 days of meal pairing, having larger meals split proportionately with a perfect amount of fiber, and she went back in and they were under half of the labs were like 50% better. So the
awesome.
doctor was like, what? And she goes, I'm staying on this. I'm like a lifer. And I go, that's fine, Sandy. So now we've taken her, and she's, she's not young. She's not old either, but we've taken her from a place where, she initially came in with lab work that was not very good, and it astonished her enough to get a nutrition coach.
Yeah.
She's now at a place where she's what I would call an evolver, and she has started she added first 1 to 2 days of strength training. Now she's at like 3 or 4 days of strength training. She does some bike riding. She has everything completely in balance.
Yeah.
So
that's awesome.
And it's been, not even a year, but she'll be going on a year here soon. So pretty cool. I think it's 4th of July is her year marker.
That's cool.
And
I think that's so important for people to realize too is nutrition can make a big difference in hormone and balancing everything, and
it makes it faster.
Exactly, and oftentimes it gets forgotten, or it doesn't get utilized because the doctor doesn't know how to utilize it.
It's the gray area.
Exactly.
There's black and there's white, and HRT is black, and the white area is doing pretty much nothing and expecting the same result. And then there's that gray area in there, and if you change the lifestyle factors, the sleep, lowering caffeine consumption, oh my gosh.
Yeah, absolutely.
And, adding good, high quality, nutrient dense food with good micronutrient intake, these people recuperate fast, especially with HRT.
Yeah.
But, even with the natural hormone replacement therapy, they do great if their nutrition is where it needs to be, especially if they're eating efficient meals, and they're being able to wait longer between eating, and the blood sugar is balanced, and the insulin is more of a stable state instead of having insulin hits every hour to 2 hours. It's like, you don't need to snack like that.
Yeah, absolutely.
Get these meals in. Stop being a weirdo.
Yeah.
Agreed. Yes, that is like the number one thing I tell my patients.
Stop
Agreed.
snacking.
Yes.
You're driving me nuts with that.
Yes.
All you're doing is just training your body to be, responsive to insulin every hour. It's not your metabolism, it's your insulin.
Yeah, absolutely, yes.
Come on, people.
Yes.
So tracking nutrition, reverse dieting, decreasing caffeine, increasing sleep.
Yes.
Training or modifying an exercise routine.
Yes.
Those are all some first line ways that you can go and help yourself with balancing your hormones. Now, let's get back to the HRT part a little bit. So, Dr. Alex, how realistic is it to have, or maybe we should start with this. Can you explain a little bit more about a natural approach to hormone, aside from what we just talked about with Kelli? And then when would you use that over actual replacement using prescription hormones?
That's a great question.
That's a really good question. So there's a scale, I would say like a scale in hormone replacement. So at one end, you have natural hormone replacement. What does that look like? In my practice, that almost always looks like it's some sort of herbal replacement. So if you think about it, herbs like tribulus, for example, is an excellent testosterone herb, and it helps to boost your testosterone. And then on the estrogen side of things, any sort of like phytoestrogen can help with mitigating estrogen symptoms in the body. So it's not giving estrogen, but it's mitigating estrogen symptoms because it acts like estrogen. That I would give with the building blocks of kind of healthy nutrition and hormones. So definitely treating the adrenal glands, which would usually be adaptogenic, like some sort of adaptogenic supplement, and DHEA normally would be that kind of cocktail depending on what was going on with the patient. Then you kind of go down the line. So as you go down the line, the first defense on like actual hormone replacement would be doing transdermal creams. A lot of patients do really great with creams. The nice thing with creams is that if you're not as deficient, they are a lot more stable. So in some patients who don't like the spikes that can be associated with some hormones, creams can be a great option. Falling kind of in that same range would be like, or doing like a troche, which is like an oral kind of replacement. Some patients do that. I always put my females on oral progesterone. I never do progesterone cream, and the reason why is because the research shows that oral progesterone, that's what the research shows protects the uterus, and don't really want my patients getting
I
uterine
agree
cancer.
with you 100% on that.
Yeah,
I agree with you 100%.
And then down at the other end, there's so some patients will do injectable testosterone in women. That looks like monthly dosing, so it does have a little bit more spikiness to it, but it's less spiky than the than doing pellets. And then with pellets, you have it. The nice thing is it's longer in patients. It lasts a little bit longer, but the dosing tends to be a lot higher at the beginning, and then as you burn through your pellets, a lot lower at the end. So you have these spikes. So it really just depends, and that's kind of a conversation with patients on what you're looking for and stuff like that. I will say almost always I start my patients somewhere near the lower end of the spectrum, because I feel like if you start at pellets, it's way harder to start at pellets and go down than it is to start at creams and go up.
Yep.
And so that's why I always have that conversation with my patients. You know, you can always move in the other direction, but going the other way is hard. Mm-hmm. And that's why like Kelly made a little face when I said injectable testosterone in women. Mm-hmm. Honestly, it's not common to do it, but the reason why people do it is because they're on pellets, they want to come off of pellets, and going pellets to cream is like
dead.
Yeah, it's ridiculous. And so that's why oftentimes you'll kind of have to go step by step down, back down the ladder.
Yep.
Yeah, that's what that looks like.
Awesome. Now, can you speak to how can someone, or let's say you have a woman that's having this symptom, or is having these symptoms that we've talked about. How do they know they're getting good hormone care? How do they know stuff isn't being missed? How do they know what to look for in a doctor that's good at this? So can you, and Kelly, you obviously have some experience with this as well.
Gosh,
maybe the two of you can answer.
Yes.
Yeah. So
we can answer.
Yeah, definitely. That's a really good question. So the number one thing that I think is honestly, in menopausal women, I talked about the fact that your adrenal glands take over your hormone production. So if nobody has ever talked to you about your adrenal glands ever, then maybe you need to start looking at that. Doing straight estrogen, testosterone, progesterone without looking at the rest of it is honestly a recipe for kind of shutting down your body as you go through. And there is a safety profile with hormones, so you want to make sure that you're balancing the body so that eventually you can hopefully come off with those hormones.
Yes.
And so I think that's important. I think doing oral progesterone is important. I know there are definitely doctors that disagree with me, and that's fine, but like in my practice, that's the rule.
The data's there.
Yeah. And then things like making sure that you're doing your proper testing. So like in my practice, you do not get hormones if you don't do a mammogram. Yep. If you don't want to do a mammogram, that's fine. You don't get hormones. That's how this works. And making sure that you're doing stuff like that's really, really important.
My client wants to know, can you please post her information? Ivana, I will post her information tonight for you. Absolutely, 100%. This is why it's so awesome doing these things.
Yeah, absolutely.
Can you hear us okay, Ivana? Are we coming in pretty clear? Because I'm going to keep this running. I'm actually going to run it for the male portion of it too. So this is great. I've got the live going. We've got the podcast going.
Yeah, no, thank you for that. It's awesome.
Two birds with one stone. But no, I feel she's so spot on. You know, I get people that are just so confused. It's not easy to read lab work anyway, because again, we talked about this a little bit before we started. The scales are very different for different doctors. If you go to your general practitioner, the scale is going to be different than probably an OBGYN. Do you see that a lot? The OBGYNs are very different scale.
Yeah, absolutely.
Yeah, so what we see as being low end wouldn't necessarily be low end on a different scale for somebody else. So telling me that you have 1.25 this or that isn't going to mean a lot to me unless I see the actual lab work and I can, take a look at it. And, it's very, very clear. A lot of these people do not have the adrenals tested ever. It is such a huge thing because if you're looking at my test population, most of them are over-exercisers, under-consumers of food. Mm-hmm. What's going next? The adrenals are going to be taxed hard.
For sure.
If these people are putting themselves under chronic stress every day with work, psychologically, physically, physical stress, cardio for hours, weight training, also physical stress, and I've talked to my clients about this many, many times. There's a good chance that if you've been doing this for many years, your adrenals are shot. We're very careful not to discuss quote-unquote adrenal fatigue.
Right.
Because, again, the problem is bigger. Mm-hmm. It's not just the adrenals. I've never one time seen... have seen a client that doesn't have another hormone issue if they've got adrenal quote unquote fatigue.
Yes. Absolutely.
Yeah.
I 100% agree with
Thank
that.
you.
Yes. It's never just one hormone.
God, I was scared to
If
say
it's
that.
one hormone, you're not doing it right.
I never want to be offensive, and I
Yeah.
know we've talked about, I talk to them a lot about natural medicine, because I think you get a natural medical doctor that knows what they're doing. Oh man, I prefer that 8 ways from Sunday to somebody that is just going to give you 8 prescriptions and send you on your way and go, thank you for paying off my student loan debt. It's really bad out there. They want to put you on antidepressants for everything. And with some of these women that are perimenopausal, or even, you probably know, Dr. Alex, they say, I have really extreme anxiety or depression.
Yes. Yeah.
Yeah, your hormones are insufficient, like really insufficient.
Yeah, I think that's a good.
Those
are definitely some symptoms that we didn't mention, and those are 2 big ones for sure.
Yeah.
That's a big issue in menopausal women, and it's something women don't talk about. It's something they don't talk about. They'll talk about their weight, they'll talk about other things, but they won't talk about that for some reason. And
they don't want to be weak.
Absolutely.
They don't want to seem like they're weak, man. Women are so strong.
Yeah.
It's crazy.
Oh yeah, for sure.
And the other thing I see with that is that with anxiety and depression, oftentimes I'll see subclinical hypothyroidism, where their thyroid actually isn't functioning very well, translate into anxiety and depression.
Yes.
And a lot of my anxiety patients will say to me, well, wait, doesn't that mean I have high thyroid function? No, it does not mean that. And so I see that correlation in my
as
practice.
Well. Yes. Major, or I'll see only T4 deficiency and depression.
Yeah.
That's it.
Yeah.
No testosterone being out of line. And again, we got to talk about being out of line, because like, if you're 40 years old, right, and you're a female, your test and your hormones are going to come down a lot between the age of 20 and 40.
Mm-hmm.
Yeah,
50%
absolutely.
is what they say.
Yep.
Pretty close. So looking at yourself like you're a 25-year-old when you're 40 those aren't the correct goggles to put on. You need to take those off, and you need to look at yourself. It's like I tell my clients that are training at 40 but have never trained with weights before, you're not going to look like a 25-year-old that's been training for 10 years since they were 15.
Yep.
You're just not. Your skin isn't going to look the same. You're not the same. Your genetics aren't the same. Your makeup isn't the same. Your build isn't the same. Your structure's different. Your hormone profile is definitely different.
Absolutely,
right?
Yes. And your goal shouldn't be to be 20. Like, that shouldn't be even the goal, you know?
Gosh darn it. Newsflash, Kelly. Newsflash. But I was sitting at a table this weekend with all these young graduates from ASU, and they're like, so yeah, when did you graduate? And I go, the first time or the second time? And they're like, what? First time or the second time? I'm 40. And they're like, what? Oh man, we thought you were 29, maybe 32. And I'm like, okay, let's just keep it there. It's so great. It's so great. 40, at 40, I have to really look at things too. I'm just as guilty as some of my clients that are in the beginning phases of, their nutrition and their hormone discoveries here, saying, man, I wish I would have pumped the brakes in my late 20s and kind of looked at the bigger picture. So I'm glad that we've got these, resources like Dr. Alex and the podcast for people going forward, because I really do think HRT and hormones are going to be the untapped market, because it is such a huge issue, especially in our females.
Yeah.
I see it way more in females and night shift workers than I do in just males in general.
Yeah, for sure. So my last question for both of you, and this kind of goes back to our second episode in mistakes made in nutrition, etc., is managing expectations. So what expectations, if we have women who are feeling this way and they're doing the stuff that we said, where they're doing the nutrition tracking, they're doing the reverse dieting, they're cutting caffeine, increasing sleep, modifying their exercise, and doing hormone therapy if needed, whether it's natural or prescription, when should they start feeling better? And you can break it up with, let's start with, if they just did all the natural stuff, all the first line stuff, how long does it typically take? Obviously not everyone's the same. And then how can hormone therapy, natural or prescription, either boost or speed up, or if you can mention or speak to those.
So I would say my patients should start feeling better in the first month. Like, we'll do their initial visit, we'll run their labs, we'll do their treatment visit, get them on a treatment plan, and within the first month, they should start feeling better. Now, does that mean that they're going to come in my office and be 20 pounds lighter and have all the energy in the world and, like, be a bodybuilder? Probably not. What that means is that they should at least be feeling like, hey, I'm a little less snappy towards my kids, which is something that is the first thing that goes when people have adrenal problems and cortisol problems, is they just tend to be a lot more snappy. So they're like, man, I'm a lot more patient and my energy is coming back up and I'm feeling like I'm able to make better choices in my nutrition and I'm able to make better choices in my exercise and stuff like that. In terms of hormones, oftentimes that's kind of the first step. And I will say I take a slower approach to hormones. Like I take a slower dosing approach because I want to get you to the lowest minimal effective dose, right? Like I want it to work, and sometimes that takes a little bit of tweaking along the way. But in the first month, you should be starting to feel better. Oh yes. And then it depends. So like with thyroid patients, once you get their thyroid in check, they feel great. Yeah. But if adrenal's part of that, I don't even rerun cortisol for at least 3 months because there's no point. Yep. It's not going to be up. Even though they're feeling better, their labs aren't going to have changed yet. Yep. Versus like on hormone replacement, like thyroid you rerun in 6 weeks because it takes 6 weeks for the TSH to change. Mm-hmm. And then in hormone replacement, it's a lot quicker because you are going to see the labs actually change faster. Whether or not you feel better, it's not going to be overnight, but normally you should be feeling a substantial amount better in the first month if you're on the right plan.
Okay. And I can agree with her on that. From the lab work that I see, my own, and again, I've been doing HRT for 2 years, so I have a pretty good set of labs and a good starting place. And she's right. The aggressive approach is not for everyone. It would be very American, but it's not for everyone. Because again, I went into it very educated and read a lot of books on hormone replacement therapy before I actually decided to go that route. The clients that I have that are on it, that do pellets or injections, I don't actually have any females that do injections, or troches, or the creams, they usually do notice a significant difference in a month. Mm-hmm. 60 days is when they're like, wow, I actually feel like I can make it through my workouts now without crashing. Mm-hmm. Part of that is probably also the nutrition and the getting better sleep, because when your hormones are off, you're waking up every 2 or 3 hours. Especially perimenopausal women that are experiencing progesterone issues.
Yeah,
it's like
absolutely.
2 o'clock and 3 in the morning, they cannot get back to sleep. And so if that feedback is better, then I go, listen, this is progress. Hold on to that. Don't get too crazy. None of them really say, hey, why am I not losing weight yet? Now, around 90 days is when they start getting very frustrated and they're like, I'm not coming down very fast. And I'm like, it's going to take a little longer. Yeah. But the metabolism is far behind hormone optimization, just like cortisol. Mm-hmm. Just like TSH too. So TSH, I noticed for a lot of people, takes longer to change its scope, right?
Yeah. It doesn't change immediately. No. It takes at least 6 weeks.
It took me a year to see TSH improve. It was very slow, where everything else was gradually a lot better. And I see that correlatively with females who are being treated for T4 and test. Yeah. But the T3 is pretty decent because you talked about the reverse component too. So if we kind of look at that and we go, okay, T3 is all right, cortisol must be okay. And now we're treating T4, and T4 is looking better, and TSH is slowly looking better, and test is looking way better. You can assume that over time, they're going to be seeing the metabolism look better as well. Mm-hmm. That's what I typically see, and it takes. I have one client who I'm thinking of in particular. She's so awesome. She talked about this on the live as well, and she was like, it took a good 3 or 4 months for me to really start seeing my weight come down and my body fat composition look better. She goes, but I did one thing that was brilliant, and that is a great piece of advice, and that is taking progress photos from the day you start your hormone replacement therapy every 30 days. She looks night and day different 4 months later.
And I think that's so important because particularly with estrogen, women don't realize that when you have estrogen, you gain weight in your gluteal-femoral region. So basically your butt and thighs, because that's associated with fertility, right? And in menopause, as estrogen declines, your weight will shift up to your abdomen. It's just, that's
the way
what
it
happens.
goes. Yeah.
And so you'll see a difference in just even like the contour of your body more than the
Sure.
And that's why progress photos are so important.
They are, and for somebody who's doing testosterone, especially women that are doing pellets in particular or injections, I do notice that if the estrogens become too abundant, they're now no longer a midsection store. They are more of a thigh store.
Yep.
Or buttocks and thigh store.
Yep.
I've seen it in myself. I've had to train out of it, and I've had to modify my macros because of that a little bit.
Yeah.
And then I would do the herbs, the anti-estrogen herbs.
Mm-hmm.
So I have an anti-estrogen herb that I do when I start to notice that that's maybe a little bit more causation than correlation. And correlatively, when my testosterone has been a little higher on the months where I maybe went only 10 weeks between having the pellets, now I'm going 14, and I don't see that as an issue as much, the higher estrogen production. Is that?
Yeah, definitely. I mean, part of it's finding that balance, and finding the balance takes time. It's not overnight.
So I would agree her approach to starting lower is very good because, people get so disillusioned and they want instant results, but guys, none of it's instant.
Mm-hmm.
You've got to have realistic expectations, especially with fat loss. You want to fix what's going on internally first, and then you can focus on the metabolism because it's going to run that direction anyhow.
Yeah, absolutely. The other thing that we didn't mention that I think is funny that neither of us mentioned this is that the other thing for managing expectations is actually just not getting on the scale as much.
Oh, yeah.
Like, take measurements. Get good measurements run, do something like that, but
Get
women
off the
just
scale.
jump on the scale every day, and honestly, first of all, women can gain 5 pounds just in bloating in one day, like literally.
Fiber.
That's part of being a woman.
Yeah.
But on top of that, you're going to see, as long as the muscle mass is shifting, if your clothes are fitting better, if you're getting into your jeans easier, that's what matters. And the scale, like the number on the scale, doesn't matter as much. And I 100% realize that this is super challenging for women. I have to remind myself of this a lot, right? And Dr. Matt reminds me of this as well sometimes. Like, it's important. And
Stay
so
off
I get
the scale.
it, but that's really important for managing expectations.
Yeah, and as a coach too, and as a doctor, I think if we can set those expectations up with them. That's why I wanted the gal to call me before she does go and get some hormone replacement therapy or explore that. Here's what to expect when you're coming off of your birth control. Here's what to expect if you see that. I mean, I wouldn't even repull labs after coming off of the birth control pills for at least 3 months.
No, it's
pointless.
Yeah, it's completely pointless.
Completely pointless.
And I will say, coming off of birth control, herbs will get your cycle back. They will do it they
immediately.
Will do it. They will do it.
Yeah.
They're
it's
like
the same
magic.
thing with not having a cycle or amenorrhea. You get the food and you get their nutrient and micros and macros met, and you start adding in the herbs, and they will almost have a cycle within 60 to 90 days.
Yeah, it's crazy. It is. It's crazy.
It's so awesome.
Mm-hmm.
And that's like, we're talking about people who have been overtraining for years. I see it a lot in my professional athletes.
Yeah.
Amenorrhea. They haven't had a cycle in years. And I'm like, you do realize that that's not healthy, right?
Yep.
What? And they're like, oh, really? I just thought it was because I'm low body fat. I'm like, you're not really low body fat.
Mm-hmm.
This is not good. Are you going to have kids someday? Do you want kids someday? You should probably take a look at this, And then we get into the IVF side of things.
Yeah. And then,
that I bet you're seeing a lot of people talking about not being able to get pregnant.
I am seeing a lot of that.
Yep.
Yes, absolutely.
Might be another episode.
Yeah, I think so.
We might be on another episode.
So we'll go ahead and wrap this up. I think we threw a lot of information at you. I think that's a great show. I mean, y'all did a fantastic job with that. So just to wrap up and summarize a few things, we talked about hormone optimization and nutrition for women. And this is typically for anyone in general, but women that are typically having these issues with hormone imbalance, etc., they are experiencing low energy, weight gain, or having difficulty losing weight. They may have low libido, cycle changes, and then anxiety and depression, which we didn't mention earlier until later on the show. So a few things that we've kind of flushed out that are some common characteristics among these women are they're typically under eating, they're usually restricting carbs and sometimes fat as well. they don't sleep enough, they're overtraining, and they're consuming too much caffeine. So stop doing that, you're hurting yourself. And Dr. Alex and Kelli would agree with me on that.
Yeah.
In order to start working on addressing and getting rid of these symptoms, we kind of have a little step program here, and the very first step is starting nutrition tracking, where you're looking at your macro breakdown, making sure that they are at good percentages, and you can listen to some of our other podcasts that we've done with Kelli to get more information on that. In one of those podcasts, we also talked about reverse dieting, which is going to be step 2 of that nutrition tracking, decreasing caffeine, increasing your sleep, exercise modification by not overtraining and kind of bringing down the volume of training that you're doing. And then assuming all of that works, you should start feeling better in about a month. And if it doesn't, realistically, there's something more going on, and you'll need to get go see a doctor who specializes in hormones, and make sure they run the right tests. We gave a list of some of those earlier, and you're realistically going to need some sort of hormone therapy, be it natural or prescription based. So at the end of the day, you want to make sure that if you are seeing a physician for hormone therapy, make sure that your adrenals are being addressed. Oral progesterone is what Dr. Alex and Kelli both agreed is the preferred way to go for progesterone. Make sure that proper testing is being done. So are they screening for mammograms? Are they running the right labs in the first place? And then at the end of the day, if you're going and seeing this doctor, you're having these symptoms and they're telling you that everything's normal, you should probably get a second opinion and get it addressed by someone who, don't go on a witch hunt, but at the same time also know that not all the doctors are going to read the reference ranges correctly. But if you do all that, you should again be feeling better. In a month, it's going to take longer for some people, and you're not going to be 100% in 1 month, but those are all things to consider if you're experiencing these symptoms. So again, Dr. Alex and Kelli, thank you for being here on the show.
Yeah, thank you.
We hope you enjoyed the show, and thank you for listening.